dare you to watch this video to the end and let me know in the comments your view. Having bariatric surgery, weight loss surgery, taking the easy way out? Bariatric surgery is often stigmatized as taking the easy way out. Research suggests that patients with morbid obesity choosing to have surgery is not the easy way method, but more like the last resort to be able to address their health problems. In most cases, the potential bariatric patient has to do the following. To ensure they're mentally ready, they will have to have at least one, if not multiple, evaluations by a psychologist. They will also consider their mental health history, as well as depression and any eating disorder behaviors. A registered dietitian or nutritionist will meet with them regularly and ongoing. They will explain the dietary needed changes before and after surgery. If a patient has diabetes, they will have to manage their blood glucose first. For some insurance approvals, a patient has to prove that they can lose weight before even having weight loss surgery. This will help them to see if they're committed and will be able to improve their outlook after having the surgery by losing some weight first. Their healthcare team will review their medical and surgery history as well as laboratory tests to see how weight loss will impact them after having surgery. They also will be screened for sleep apnea and heart disease. If they've had past surgeries, especially anything to do with their digestive tract, they'll be asked for additional imaging and certain tests. This may include a chest x-ray, an EKG, an upper GI test. The upper GI test is just to ensure that there's no blockages or narrow spots in the upper intestinal tract. This test can also look for ulcers, polyps, and any stenosis. They also might be asked to do an endoscopy, which is inserting a tiny camera down to the small intestine, and it's just looking for the same thing. Is there any ulcers? Is there any damage? Is there anything going on in that digestive tract that will hinder the surgery that's coming up? Depending on the person's situation, they may be asked to do a pre-op diet of full liquids anywhere from 3 weeks up to just 24 hours before the bariatric surgery. There's many variances of the pre-op diet, and it will depend on the bariatric program. Depending on the person's situation, they may be asked to transition through 4 separate food stages, food phases. This can last up anywhere up to 6 weeks to 2 months after having bariatric surgery. Depending on the procedure and the job requirements for that person, they may be asked to take off up to 4 weeks for recovery. 6 months to heal. It takes up to 6 months for the body to completely heal. Mindset. Bariatric surgery is not a quick fix. It will force the body to lose the weight physically, but the patient's still gonna have to work on losing the mental and emotional weight. For the rest of the person's life, they will have to understand the vitamin and nutrition absorption challenges. Depending on the person's medical history and additional needs, there might be additional evaluations, testing, and imaging required. If you believe that weight loss surgery is taking the easy way out, I'm here to tell you it's certainly not. Weight loss surgery is an assistive device. It's only one tool in the toolbox. The reality is the hard work happens after having surgery. Nothing about weight loss surgery is easy, and saying that someone is taking the easy way out just diminishes and disrespects the effort, the choice, and motivation for that person in choosing that decision. Is bariatric surgery weight loss surgery for everyone? Heck no. Are you worried that your relationship is going to change after your loved one has bariatric surgery? If so, then I really highly recommend that you watch this next video to help you just understand, will your relationship change? Do relationships change? Is it just a given?